Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patients to access the right treatment on right time. It is my immense pleasure to introduce Dr. Krishnamani, a pioneer medical professional specialized in medical oncology. Dr. Krishnamani has more than 10 years of experience. Dr. Krishnamani is associated with American Oncology Institute of Hyderabad. As you all know, April is a month which is dedicated to raise the awareness about head and neck cancer, which is very common cancer in India, and sadly to address that these cases are also increasing day by day or year on year. So today we have Dr. Krishnamani who will guide us in the journey of know about the head and neck cancer and how also to increase the awareness of the for the same. Doctor, let's extend a warm welcome to Dr. Krishnamani. Doctor, welcome to this forum, Doctor.
Hello and welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. Thank you for joining us. As you're all aware, April is the Head and Neck Cancer Awareness Month. So today our focus would be on head and neck cancer and the basics of head and neck cancer with more emphasis on the risk factors of head and neck cancer and how we are going to prevent head and neck cancer. The specific treatment aspects and other things, we'll probably cover it in other schedules. But this is a awareness month where head and neck cancer being so highly preventable, our focus is going to be on prevention.
Thank you, Doctor. Thanks a lot. So, without any further ado, let's start this exciting session. Doctor, just to know what exactly is head and neck cancer?
So, to put it very simple, head and neck cancer is a cancer which starts in the head and neck area. So, we are basically talking about lip cancer, tongue cancer, oral cancer, pharyngeal cancer, larynx cancer, voice box cancer. So this is head and neck cancer. So we put everything in a single term, but for medical people, we call it either oral cavity cancers or oropharyngeal cancers or nasopharyngeal cancers. So the tumor or the cancer which starts in any of these areas falls in the category of head and neck cancers.
Okay. So, Doctor, nasal cancer also is covered in head and neck.
Nasopharyngeal comes under head and neck cancer.
Oh, okay,
So
okay.
this is the whole area, right? Your sinuses, your nose, your lips, tongue, base of the tongue. Palate is the roof, then the floor
Okay,
of the
yes.
mouth, then the buccal
Yes.
cavity, okay?
Oh,
Then the pharynx, which is the portion where the digestive system actually starts, and then the nasopharynx. So all this come into head and neck cancers.
okay. Doctor, like in India, how common is like head and neck cancer?
Head and neck cancer is still the commonest cancer, or at least is one of the two most common cancers amongst men in India. So it is lung cancer and head and neck cancer, and in certain parts, for example, the northeast, like in Aizawl, in certain areas like in Pondicherry, okay, or even in Delhi, head and neck cancer is a number one cancer. So if you look at men, head and neck cancer is ranked number one, especially in the rural areas. And overall, head and neck cancer is one of the top 3 or 5 cancers in the country. So it's an extremely common cancer across the country, with certain geographies having more cases. For example, it is reported that Aizawl has the maximum number of oropharyngeal cancers anywhere in the world.
Oh my
Okay,
God.
that's the burden of head and neck cancers in our country.
So
It's a
in
common
short,
cancer in our country, and most cancers, head and neck cancers in India, present at a very advanced stage, unfortunately, because of lack of awareness and our habits and all those kind of things. And unfortunately, the mortality or the death rate from this cancer in India is pretty high when you compare it to the West, because the delay in presentation, the advanced presentation, and the delay in treatment, or the interruptions in treatment, or the inability to complete treatment due to side effects or nutritional issues which compromises their treatment. So it is common, it is deadly, it has a high death rate, and It is also seen a lot of young population in our country, men more than women. Men get these cancer 3 to 4 times more common than women, and at a
Oh,
very productive age group in their life, maybe in their 30s, 40s, 20s, or early 50s, because of which it puts them back financially. They're unable to work, they become dependent, and as we know, it leads to a lot of financial strain on themselves and their families.
very truly agreed, sir. Generally, in the 30s to 50s is a age where the responsibility also increases and also the earning demand for the family also increases a lot. So, doctor, generally, is there any like symptoms or something you can catch early, like any head and neck cancer?
So you mean risk factors for head and neck cancer?
Yes, doctor. Associated with risk factors
What are the risk
associated with head
factors?
and neck.
So, see, the commonest risk factor we have to remember is tobacco. So, tobacco in the form of cigarettes,
Hmm.
pipes, cigar, chutta, beedi, and smokeless tobacco, pan masala, gutka, zarda, chaini, amber, and all these kind of things. So, cigarette or smoked tobacco in its variant forms, and smokeless tobacco. This is the principal cause of head and neck cancer. And understand this is a habit forming agent which starts very early in school or college. So
Yes.
10 years or 15 years into the habit, by their early 30s or late 20s, they develop head and neck cancer. So there's another interesting thing called reverse chutta smoking.
Okay.
So if you imagine a cigarette or a chutta, it is this way, and
Hmm.
the lit end is at the other end. So when somebody smokes, this part burns,
Yes,
and this
yes.
is the hand. Now, in certain countries like Sri Lanka, and
Huh.
in India, for example, in Vishakhapatnam, Vijayanagaram, Srikakulam districts, you find reverse chutta smoking. What is that? The lip end is kept in the mouth.
Oh.
Okay.
Huh.
So it started off with a tendency that the women wanted to smoke, but because of the men folk in the house,
Hmm.
could not. So to conceal that as a habit, they kept the lip end inside.
Huh.
Number one. Also, the other reasons which these men or women give is when they smoke,
Hmm.
for example, the fisherwoman, the tar or the lip end, it falls on the fishing net and it spoils the net.
Yes.
So because of which they smoke it this way. Sometimes the ash falls on infant babies whom
Huh.
they are nursing. So that's why they keep it this way. Sometimes uh, when they are smoking and they are working, for example, they're spraying water in the field or something, the
Hmm.
lip end becomes wet and they cannot smoke. So
Yes.
these are the multiple reasons which these people have told, and these are not just hearsay things. These are studies conducted in people, especially women who do reverse chutta smoking, and the reasons for it. Now, the problem with reverse chutta smoking is it is even more dangerous because the whole the oral temperature goes up to more than 70 to 120 degrees Celsius.
Oh. Oh.
Okay. Because of which the temperature in the oral cavity becomes so high that the mucosa or the inner lining it becomes burnt. And
Yes.
their chances of getting cancer are much more high. So, cigarette smoking, reverse chutta smoking, tobacco in all forms like pan masala, zarda, etc. If you look at the zarda eaters or the betel nut eaters, they keep the
Hmm.
lip like this and they stuff it here. They stuff it in the inner part of the lip and they keep it like this. So they have a high
Yes.
chance of getting lip cancers or buccal mucosa cancers, we say. So biggest risk factor is tobacco. You stop tobacco, you can reduce head and neck cancers in a very big way.
Sir, like you were addressing that Imphal or the northeastern country came first in the world. Is it because the high consumption of tobacco is very high in those areas?
Yes, yes. But it's a part of the culture. It is because of the weather, multiple things. Now, for example, if you look at Gujarat,
Huh?
uh, I don't have data to back what I'm saying. There must be data. I have not read it, but what I'm trying to say is when there was a ban on alcohol
Yes, yes.
and smoking, I think tobacco
Hmm.
chewing increased because
Oh,
somewhere these guys have to get a high or they need to have the habit. So the tobacco smoking, tobacco chewing increased due to the ban on cigarettes or alcohol, especially in Gujarat.
oh. Sir, actually, just I don't know whether it's the right platform or no, not, I don't know. But when I went to Gujarat, like I did my studies in Gujarat, over there, as you rightly said, alcohol is banned and even smoking is not allowed in the public areas. Even in the parking, they doesn't allow it. So you won't believe all the walls are in pink or red color.
Correct.
That is because of
Because
the
they eat and they spit them in there.
exactly
So that's the
all the
problem.
walls.
The other problem is alcohol. Alcohol increases the risk of head and neck cancer. And many smokers
Okay.
drink alcohol also.
Yes.
A very important risk factor is HPV virus, human papilloma virus, which
Okay.
causes cervical cancer.
Yes, yes.
So
Huh.
the same virus also causes oropharyngeal cancers. It
Oh.
occurs in younger people.
Hmm.
It has a good prognosis. These patients do well. These patients generally have a small tumor, but they have large lymph nodes.
Hmm.
Predominantly causes oropharyngeal cancers. And most of these patients are usually not active tobacco or they don't consume tobacco or smoke. So
Okay.
it's a good prognosis compared to tobacco-related cancer. Oropharyngeal cancers are common, young age is common, small primary tumor, large lymph nodes, and they do well. There is another virus called Epstein-Barr virus, which causes nasopharyngeal cancers, which is common in the China part.
Oh, okay.
One thing with regard to HPV, which missed my mind is, as we have discussed, the vaccine for HPV. So
Yes.
we always say vaccine for cervical cancer.
Hmm.
Vaccine is also for oropharyngeal cancer, anal cancer, penile cancer, vulval, vaginal, which we discussed. So
Yes,
boys
yes.
and girls both will benefit, especially boys and girls for oropharyngeal cancer. And there are certain other risk factors like HIV. When you have HIV, your immunity goes down, the risk of all cancers increases.
Hmm. Yes.
Genetic, yes, there are some genetic conditions like Fanconi syndrome, we say, where people can get head and neck cancers. But by and large, the common risk factors are smoking, tobacco, alcohol, HPV.
So as you rightly said, HPV virus, when the vaccine is taken, it can be take care of so many cancers.
Six
Apart from that,
cancers and one anogenital wart, one benign condition.
oh, so it's just some bad habits. If it is removed from the respective person's life, the cancer can be avoided.
True.
So, doctor, like as you were addressing about the tobacco, smoking, reverse smoking, which is something I first time heard, the innovative methods of taking tobacco by women in reverse smoking. So, doctor, what exactly is the role of tobacco, mainly focusing on head and neck surgery? Can you please just explain in depth, doctor?
So what is the role of tobacco in? Sorry.
Head and neck cancer in depth.
So, see, tobacco contains nicotine
Hmm.
as a cancer-causing material.
Yes.
So, repeated exposure to that causes mutations. So,
Okay.
when you chew tobacco or continuously smoke tobacco, there are changes which happen in your mouth. After that, first it may become pinkish or reddish. Then you may develop a white area called leukoplakia, or you may develop a reddish area called erythroplakia. These are the steps away from cancer. So then and there itself, you should identify, you should stop smoking. If it progresses from that, it becomes cancer.
Okay.
So normal mucosa, damaged mucosa, leukoplakia, erythroplakia, we also call it keratinization. And then after that, it goes into cancer.
Okay. So, like in cancer, we hear that there are first stage, second stage, third stage, like that. So in head and neck cancer also there will be some stages.
Yes. So it depends on the size of the tumor. It
Okay.
depends on whether it has spread to the lymph nodes. It depends on whether it has spread to the nearby organs and whether it has spread to other areas. So that
Okay.
we are going to have a separate session on that, on
Oh
how
yeah.
what are the symptoms, what are the tests to stage, how do you scan,
Hmm.
and what are the treatment modalities.
In fact, doctor, telling you head and neck cancer awareness is so important in India. As you told, in the entire world, we have one of the state which has ranked as first. I guess the one session, it won't be enough to spread the awareness.
Yeah, see why it is important is this tobacco is also responsible for non-cancer conditions like heart attacks,
Hmm.
pulmonary problems like COPD, emphysema.
Oh,
It can cause
okay.
16 varieties of cancer, 16 different varieties of cancer, including blood cancer. You spend a lot of money on smoking. Okay,
Yes.
it's a habit forming thing. Then there is something called second-hand smoke. Because if
Hmm.
you are smoking next to me, I will inhale it passively. I am at risk for cancers and respiratory problems. So it is not a one small thing. And these are all preventable. You
Very
can
true.
stop smoking. You can take HPV vaccine. You can identify the stage of leukoplakia, erythroplakia. So multiple areas you can actually prevent or stop head and neck cancer. Because the guy who starts it young will have a horrible life when he's in his mid 30s or 40s, the midlife crisis. Because
Yes.
once you get head and neck cancer, life is bad. You undergo
Yes.
mutilating surgeries.
Yes.
You cannot open your mouth. Your face is disfigured. Osmosis is an issue. Eating is an issue. You have to take only liquids or semi-solid diet. Dentition is a problem. Recurrent oral infections. Breathing can be an issue. Sometimes you're on a tube here called tracheostomy tube. So it is not one single thing. It is multiple problems.
In fact, sir, our, as you told, drinking and smoke, like drinking and taking breath is our day to minute activity. That will get disturbed, which is very difficult to survive.
If the disease will kill you every day slowly,
Uh,
the treatment also has its own share of side effects.
Very true. Even doctor, just to highlight, whenever we go to theaters to see a movie, there is always one advertisement dedicated for an oral cancer with one lady who will say how happy her life was. Looking on the face, the entire half of the face, her, it is patched up. Looking at that, it feels so sorry. And recently now they have started that she died at the age of 28 years. She has recently died, I guess, that lady. So the advertising is still continued, but there is a hashtag telling that that lady died at the age of 28 years. That's not at all a right age for a person to.
It's absolutely preventable, and you are inflicting pain on yourself.
Okay, okay. Sir, actually, from where to where, as you were doctor saying that what is the, you have explained what is the role of tobacco in head and neck cancer, but you are also talking about something called virus. So can you, doctor, please brief us more on what exactly is the role of virus in head and neck cancer?
The viruses is what we spoke about.
Yes.
HPV, Epstein-Barr virus, HIV virus.
Hmm, yes.
Commonly HPV, for which vaccination is available. That is
Yes.
what we should understand. So let our people know that vaccination is not only for cervical cancer, but it is also for oropharyngeal cancers and six other types of cancer. For both boys and girls between the ages of 9 and 22, preferably between the ages of 9 to 13.
Is there like a, what are the prevention and screening for head and neck surgery?
So the prevention is stop alcohol, stop smoking, stop zarda. And
Ah.
if you have a sharp tooth, dentition,
Hmm.
sharp tooth, meet your dentist because that can irritate the tongue or a low inner part of your cheek and that can lead to cancer. So if there
Oh,
is any sharp tooth, meet your dentist and get it corrected.
okay.
Screening, as I told you, the chronic tobacco chewers or smokers regularly get yourself screened after you abstain smoking or stop smoking. Check for leukoplakia and erythroplakia, white and red patches. If there is
Hmm.
a doubt, the doctor will take a biopsy.
Hmm.
And cervical cancer vaccine, which is either a 4-valent vaccine or 9-valent vaccine, which contains 4 strains of the virus or 9 strains of the virus for both boys and girls. If you're below 15, you require 2 doses. If you're above 15, you require 3 doses. Not expensive, available in India for both boys and girls.
Sir, what if somebody has not taken vaccine and he is above 30 years then?
Sorry, if somebody has got a
Who has not taken vaccine and he or she is more than 30 years or 35
it is
years
not
like that?
dependent. We usually uh, give the vaccine to somebody between 9 and 22. And when you talk about cervical cancer specifically, it is before the first sexual activity. That is the whole
Okay.
point.
Okay, that's the reason it is between 30, because even when we were discussing on before our previous videos also regarding the cervical cancer, in that also this age group was mentioned. So that question was hindering me from that time.
So people do vaccinate even at 26 or 27 if they have not had sexual activity. But the older you are, the immune response will be less. That's why they require 3 doses. The younger
Okay.
children will require only 2 doses today and 6 months later.
Oh, so something very new. Doctor, you were saying something in China, there is nasal cancer, nasopharyngeal
In
cancer.
China, there is a specific, in China or certain parts of China, nasopharyngeal cancer is very common.
Any
It's because
reasons
of
or particular reason?
the Epstein-Barr virus is implicated in
Oh,
that.
okay.
Nasopharyngeal is very common. There is also certain diet, like the diet which is rich in nitrites can
Hmm.
cause certain cancers, oropharyngeal cancers, which is common in the southern parts of China. Because the
Oh.
meat when they cook releases nitrites, which
Hmm.
is carcinogenic. On
Oh.
the contrary, uh, fruits and vegetables seem to have a protective effect on cancer, head and neck cancer. So a diet rich in fruits and vegetables is always encouraged.
Oh. Anyhow, doctor, it is told that green leafy vegetables and fruits are always healthy for a person. So obviously, and in China, they eat everything and anything. So that was the reason why I asked that, is there any particular reason, doctor? Doctor, I know there are so many things about this head and neck cancer surgery we can know about, but unfortunately, we have just drawn the webinar to the end, or you can say to the close only for today. So, as we have drawn this webinar to the close, I will extend an heartful thanks to Doctor for giving us such a wonderful information about awareness information about head and neck cancer. Just an hashtag that it is to be continued session. So, doctor, would you like to add some closing comments to this session, doctor?
So our session doesn't end here.
Yes.
The next session we will, as you said, to be continued. But the message which should go out is no tobacco, no alcohol, the vaccine for cervical cancer, which also works for oropharyngeal cancer, and let's stop head and neck cancer. That should be the mantra.
Yes, very true, sir. And also, just a message, smoking and tobacco chewing is not at all a stylish
Yeah.
icon, I can say.
It's
Nowadays,
nothing
they
to call
think,
it what's stylish about it. It is
yeah, but
sounds
health is on a course. So thank you once again, doctor. Thank you very much. Thank you once again, everybody who has um joined us to fight against this challenging disease, which is head and neck cancer. So thank you very much. Stay
thank
informed
you.
and stay healthy from cancer. Yes, doctor.
Thank you.
Thank you, doctor. Thanks a lot.